You are watching the DocTalk show.
Welcome back. We are discussing hydrocephalus, a condition characterized by excessive water within the brain. And among the common causes in both children and adults are infections. Infections such as meningitis or tuberculosis can result in blockage of these water channels and ultimately cause increase in pressure and hence the condition hydrocephalus. We have learned that this condition in adults can become a medical emergency because pressures within the fixed rigid skull of the brain will result in a compression of the brain structures and can result in death. So we are going to discuss with the doctors in studios exactly how this medical condition can be treated and most importantly how we can prevent acquiring this problem. So maybe I'll start with Dr. Noah.
Yes.
Yes. Are there any other hospitals that can do these procedures, these surgeries?
We can get them from the National Referral Hospital, that is Mulago, and also a regional referral in the Western Uganda called Mbarara Regional Referral Hospital.
Okay. So these centers can provide these surgeries.
They can provide them.
People suffering from hydrocephalus.
Yes. So, but like Dr. Mlondo said, for example, the alternative to a shunt, which is the ETV, was tailored, or it was started in Cure Hospital. So for us as the hospital in Uganda and in Africa, we are known for ETVs, or what we call a shuntless surgery.
For this new surgical technique.
Yes.
Okay. So so thank you very much for that information. So what I think what the viewers would now be what they're interested in learning is how we can prevent this condition called hydrocephalus. So Dr. Roni, do you want to explain to the people how exactly to prevent
From my experience in Cure, we do 100 to 120 brain surgeries a month. Of those 120, 80 are in treating hydrocephalus. Okay, 60% of the hydrocephalus we treat is as a result of infection. So definitely, the most preventable causes of hydrocephalus is infection. Okay.
And these are children's infections.
Children's infections.
Okay.
So how do we prevent these infections? It is critical that every pregnant woman attends antenatal care, because through antenatal care we screen for infections that would potentially predispose these children to hydrocephalus. That's one. The other important part in prevention of infection is delivery in hygienic places or places with good hygiene. Home deliveries, it is difficult to guarantee good hygiene at home. That is why the government is calling upon every pregnant woman to deliver in the hospital. Okay. Even the practices that hospital practices are being beefed up so that hygiene is observed.
Well, the hospitals are trying to ensure infection control measures. Okay, so you're elaborating that infection is one of the most common cause of the hydrocephalus. So if antenatal, yes, is a very, very important aspect. The infections, Dr. Noah, which you had elaborated on, which are acquired when the child is still within the womb.
Yes.
These infections are always screened for during antenatal. So it's always important for all expectant mothers attend antenatal clinic and go for screening for these infections, because it can help prevent further complications such as hydrocephalus occurring in your baby who is eventually born. And I think the same thing occurs for adults.
Yes. Who
acquire infections for whichever cause, whether it is an infection such as tuberculosis or it is due to cryptococcal meningitis. We always advocate for early treatment to prevent complications.
I think in addition to that, we can prevent the infections. But in this case, in a circumstance when the child gets the infection, it is very advisable that the child gets appropriate treatment. Usually we have a habit in our communities of treating ourselves, treating our loved ones. You see a fever, you can access a paracetamol or a Panadol and it can calm down the fever. That one does not necessarily mean that what is causing the fever has gone away. So as babies, we need to treat them adequately when they get an
With
infection.
the correct treatment.
Correct treatment and for the correct duration.
Okay.
Yes.
So, and as we conclude, I'm sure you must have had some myths, some misconceptions around this problem of hydrocephalus. When people see a child with a big head, they might have some ideas. Well, maybe you could help demystify some of these misconceptions that people have in the communities.
Take-home message today: hydrocephalus is a disease. It is not witchcraft. It is not a curse or a punishment from God. It is a disease that can be prevented, like we have said it here on this show. So we can avoid the disease. And number two, if you can't avoid it and you get the child has gotten the disease can be treated. On addition to the treatment, the earlier the treatment, the better the outcome. If you found a child who has been treated after 2 weeks of the head increasing, and you find another child who has spent with the disease for 2 years without treatment, the outcome is going to be different.
So the child who receives early treatment always has better outcomes.
A better outcome compared to one who has delayed treatment. So they appeal to the health workers, to the people that are encountering these people at the first glance. If the child has a big head, good referral or early referral to the centers that we've talked about that can handle the problem is very, very important, because it lessens, it improves the quality of life if you did operation early. Yes.
Okay.
Then the other thing, this, like I said, it is a disease. Usually the world commemorates this day. There is a day that commemorates the disease.
To recognize the importance of the disease and raise awareness about the condition.
So every year on the 25th of October, we call it the World Spina Bifida and Hydrocephalus Day. We gather in conjunction with the Ministry of Health, with the hospitals that are handling these conditions, with the parents that are being affected, with the patients themselves, and with the organizations that support these children. We come together to create awareness that though these children have disability, this is not the end of the day. It is not the end of their road. So there is life after getting a big head. After treatment, there is
suffering from the condition.
Yes, there is a brighter future. And we want to advocate for inclusion in the public facilities, in schools, in hospitals, that these children are not very different from the normal children. Though they may have a big head, they can attend the same schools if facilities allow. They can be treated in your hospitals if they have gotten a malaria, they have a cough. You don't need to send them to Mbale, to Mbarara to be treated for malaria. Otherwise, we shall kill them by abandoning them.
Okay, so that's a very important message you bring. The awareness surrounding these these illnesses. There tends to be a lot of stigma because people don't really understand what the conditions are. That's why we thank you for bringing it to light, for educating the public on some of these conditions, such as the hydrocephalus, where we learn that most of the causes are actually related to infections. So treatments of infections and prevention are some of the ways in which we can prevent this condition. And even if the children develop or suffer from this condition, they still can, if it's treated early, which is the main message here. If it is treated early, the child can have much better outcomes and can live a very normal life as the rest of the other children. So the key message or the take-home message is, much as hydrocephalus can be problematic, it is treatable and it is preventable. You have learnt of where these surgeries can be done. The treatment is usually with the surgery to relieve the pressures in the head, and you can access these treatments from the highly specialized hospitals, as we have discussed in the show. And most importantly, to prevent hydrocephalus in children, make sure you attend your antenatal. If you're a mother expecting, make sure you attend your antenatal visits and receive treatments for some of these infections that would cause hydrocephalus, and ensure that all infections are treated as early as possible.
We also want to call upon our fellow health workers. If a mother comes for antenatal care, please be sensitive and screen for these infections, okay? The mother may do her part and come, and you as a health worker fail to screen the infections, and then the baby ends up with hydrocephalus.
Okay.
So as health workers, we're also being called upon to have a high index of suspicion, okay? Screen. If you think that the baby, have a high index of suspicion that if you think that the baby has anything to do with an infection in the brain, treat appropriately. And if you pick the early signs, as we've talked about of hydrocephalus, refer early, because early referral changes outcomes.
Changes outcomes. And that's it for the evening. You have watched the DocTalk show. I'm your host for the evening, Dr. Darius Sawachi. We want to thank our guest speakers for the evening, Dr. Noah and Dr. Ronnie, all the way from Cure Hospital Mbale, for giving us this enlightening talk on hydrocephalus. You can send your questions, your comments, your queries to our social media platforms, and our doctors will ably respond to them. And we thank you for watching the DocTalk show. We shall see you next time.